Perfect. Thank you very much. I like to walk around, but I will speak highly, so you allow me that. The Swiss sought an ethical measure to prevent medicine developing to a pure business. Now we have a fact. We have in every country increasing health costs. Health costs are increasing every year, together, of course, with the primes for healthcare insurances, for instance, in our country. Peoples are not happy with that. And of course, it's a very interesting topic for politicians. And it's also an important topic for the press. This is just a graph how healthcare costs are growing in the last 30 years in relation to the gross domestic product. And you see in Switzerland we went up from 8% to now nearly 13% in relation to gross domestic product. When you look another graph and you compare salaries, there we have also an increase, but the increase is around 25% since 96, in comparison with the increase of the primes, which more than doubled in the same time. This actually is a headliner of the most read newspaper in Switzerland from yesterday. How doctors rip off patients and insurances. And indeed, reputation of doctors is heavily suffering. There is at the moment, a real doctors bashing in the press because somebody has to be responsible for this explosion of health costs. A doctor's bashing, we are no more any gods in white. We are con artists, profit first. We have got all billion salaries, and especially surgeons are titled as profit-orientated, uncaring technocrats. Ladies and gentlemen, that hurts. That hurts, especially when you have worked, as me, now 32 years in a public system with the intention to help others to have a good quality of life. When you read that, that hurts. But I assume that there are doctors under us. They are abusing the system. And they are in billion salaries, etc. So there is some guilt under us. Therefore, we have to do something against it. We have to do something against it. Just here, this is a recent thesis where they looked how medical students beginning their medical school are thinking about their future. And it's interesting that not extrinsic factors as job safety, status and salary are the important things, but much more intrinsic factors as interests, capability and pleasure to help others. So medical students are not beginning medical schools to have good salaries. That's not true. But it may change afterwards. This is another slide which actually speaks exactly for the same thing. There are people are of course going into surgery, but there are a lot of others, 1/3, they want to do internal medicine, and we know that internal medicine, it's not related to big salaries. Now, of course, we have cost drivers in our health systems, which gives an economic pressure. We have a shortage of financial resources, and this is basically based on the demographic development. People are getting older and older, also due to the good medicine we are offering, and we can't pay anymore all these costs getting up. We have also a progress in medicine. Technology is getting better and better, but also more costly. And then we have a phenomenon which I have quickly to explain. I call that defensive medicine. At some 20 years ago, when a patient went to his GP, to his general practitioner with abdominal pain, and it was not that bad, then the general practitioner said, listen, I will see you once more in 6 hours, and we look how it develops, and then we will see. I don't want to send you immediately now to hospital. Nowadays, he is afraid to miss something and to get in troubles with the law. So he is sending the patient to the hospital. And of course, we are in the same position. We can't send him home or say we wait now. And so what are we doing? We are doing costly evaluations, imaging, to be sure that we don't miss anything and not to have troubles with the law. It's coming, this defensive medicine is coming from the United States. They have the highest relation of the health cost in regard to her economy. With 17%, we are in second place in Switzerland with nearly 13%. Then we have the politicians' employment legislation for doctors. When I began my postgraduate training, I was working as required from the hospital. Nowadays, my residents and my staff surgeons are not allowed to work more than 50 hours. So we had to double residents and staff surgeons since then, to double just to cover the on-call duties 24 hours, 7 days, 365 days a year. Just for that. So employment legislation. And finally, quality control measures. Of course, we all want quality. But we have looked nowadays, my residents and my staff surgeons, they do half of the time administrative work. And most of this administrative work is for quality control measures. So I say here that with all these quality control measures we are doing, coming from the authorities, finally the quality got worse. Got worse because doctors are less at the patient's bed where they should be. They are filling up data in databases and whatever to do quality control measures. So here are some examples of important cost drivers. Pay scales, as the DRG, TARMED, bonus systems, as they called all, they all give some sort of false economic incentives. They can be abused. There is a survival fight between medical institutions, especially also between public and private ones, which leads to an enlargement of indications. There even exist contracts with benefits based on performance. So the more case a doctor is doing or performing or operating, the higher up is his salary, which is completely false. And then the kickbacks, something you have heard all of it, that hospitals, institutions are paying general practitioner money for sending them their patients. So-called kickbacks. Then the politicians, they want to regulate, they ask for minimal number of cases. And believe me, when you are a surgeon who is specialized in knee prosthesis, and you have to do now 50 knee prosthesis a year, that's actually the line. And you are now in November, and you have only 45. And you know, you live from doing knee prosthesis. What are you doing? You will find these 5 cases. You will find them. They are not indicated. Well, you tell. I remember well when an orthopedic surgeon told my father about 20 years ago that he needs both knees replaced. And I said, no. And now, 90 years after, he have had the first knee prosthesis, and 20 years after, the second one. Just to give you an example. So the pressure from politicians who are asking from minimal number of cases, increase in costs without really a quality effect, in contrary, enlargement of indications. Then the employment legislation we already discussed. The demand for super specialists. When I was in training, I learned everything what concerns the abdominal surgery and thyroid surgery, esophageal surgery, thoracic surgery. Nowadays you need for every organ, nearly for every organ, a specialist. What means? It's nice to have a specialist who is doing only pancreatic surgery, of course. But what does that mean? When he is on call and the patient is coming in with a hemorrhoidal bleeding, he doesn't know what to do. So you need then 2 specialists, one for the hemorrhoidal bleeding, so a lower GI specialist, and everybody is doing on-call service 24 hours, 7 days, 365 days. So we have much more people doing on-call services nowadays, and this costs a lot. But we want to have only super specialists because the quality apparently is better. I'm not sure about it. So I did something false. Sorry about that. Hello. Excuse me.
Please.
Okay, we were here, super specialist, and then of course the expensive new technologies like robotics. Very nice. PR measure. We do robotics, huh? But when you look exactly at that, you see that it doesn't bring anything. But it's much more expensive. I don't say we have to stop the development of technology. It's important. But we have to pay it not with the social system, but with a sort of founding or university or whatever, but not with the normal system. Voilà. Now, we can say economy dictates medicine, and medicine is more and more developing based on the rule of the free market economy. There is a real conflict between profit orientation and the professional ethos. Money dictates to a development towards an antisocial 2-tier medical system. The one who can pay it, he will get everything. The one who can't pay it, he will get nothing. Medical and ethical issues are in the background, and finally we doctors, we are losing or at least weakening our professional identity and our ethos. So it's getting a business, and the economy is not anymore. Economy is important. We agree all with that. But it's not anymore just a helping tool. It's becoming the primary control organ of our system. And health is becoming a pure market object which is sold and bought. And that's terrible. That's really terrible. And finally, doctors are becoming slave of this health business. In a direct form, when they are directly attached to money, so they do their things just to get more money. That's the direct form. And the indirect form is the one where doctors are pressed and pushed by institution to do more with contracts. Director is coming at the end of the year and says, listen, when you don't bring 10 cases more next year, then I have to put down your salary or whatever. This is slavery, ladies and gentlemen. Now, the precious relationship, and for me that's something that is very important, between patient and doctor is heavily suffering, and medical decisions are not anymore only based on evidence-based and ethical issues, but much more on economic factors, so-called external influences. And we are confronted with mainly an over, but also sometimes an undersupply of patients' care. Now, something has to be done. You all, I don't want to go now on all these principles, you all know the principles of medical ethics, the so-called Georgetown mantra. Everybody who is following a little bit ethics knows these principles. So, there are counteractive measures. One is the Choosing Wisely campaign. And when you would do a resume of the Choosing Wisely campaign, it's the courage, something not to do. Not always to say you do everything. Not anymore operating a patient 90 years old with a pancreatic resection. That doesn't bring anything. You have other measures to help these patients. There, it has to be mainly quality of life, which has a role. Then I have some colleagues in Germany. They made something equally like the Swiss oath. They made the so-called German Clinic Codex, and there the maxim is medicine before economy. And the Swiss oath goes in the same direction. It's mainly the protection of the precious patient-doctor relationship. Now, the ideas behind the Swiss oaths are, it's also a pledge for medical doctor, it's an up-to-date Hippocratic oath. All the important messages from Hippocrates are in there, but it's up-to-date, it is modernized. It's all to protect the patient-doctor relationship, to reinforce the professional ethos and the professional identity of doctors, which we are losing slowly but surely, to fight against the ongoing economization of medicine and to fight against the economic enslavement of doctors. This is the oath. I let you read it, but I want to show you at least two passages that you can see what I mean with modern. I do not exploit my patients for career reasons or other purposes, and do not impose any treatment on them that would not be acceptable for me or the people closest to me. And I would also not accept any kind of payment or other benefits, particularly with regards to referrals of patients. I do not enter into any contract that oblige me to provide certain quantities or services or to neglect such ones. This is really important, and this oath is also protecting us against hospital authorities, institution authorities, political authorities, but you can say, I'm sorry, I can't do that. I can't do that. Now, what happened up to now concerning the oath? The idea came up in 2013 by the Institute of Dialogue Ethik in Switzerland. In June 2014, we were building up the group. I was one of the founders with representatives of medicine, also doctors, philosophy, theology, and economy. In 14 and 15, we did the creation of the text of the new law, that there were a lot of meetings with a lot of discussion. Every word was turned around and weighted. And then were in 15 the first two publications first of all in the Thema in Focus, and then in the Bulletin of Swiss Medical Doctors. And then we got more and more support by societies like the Swiss surgeon, like the cardiac surgeon, and finally also by the FMH. FMH is the big organization, the association of all doctors in Switzerland. 95% of all doctors in Switzerland belong to the FMH. And the delegates supported also this oath. In June 2018, 1 year ago, my